will discuss Alpha-1 Antitrypsin Deficiency, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Today, we're discussing AAT, which stands for Alpha-1 Antitrypsin Deficiency. What are the causes of this condition? AAT is a type of protein called a protease inhibitor. AAT is made in the liver and it works to protect the lungs and liver. So keep that in mind. If anything is wrong with this, what will suffer? It's your lungs and your liver. AAT deficiency means there is not enough of this protein in the body. It is caused by a genetic variant. The condition is most common among Europeans and North Americans of European descent. Adults with severe AAT deficiency will develop emphysema, which is a lung condition, making it harder to breathe. Sometime before 40 years of age, they will develop this emphysema. Smoking can increase the risk for emphysema and make it occur earlier. What's the definition of AAT? AAT, or Alpha-1 Antitrypsin Deficiency, is a condition in which the body does not make enough of AAT, a protein that protects the lungs and the liver from damage. The condition can lead to chronic obstructive pulmonary disease, COPD, and liver disease, cirrhosis. Exams and tests. A physical exam may reveal a barrel-shaped chest, wheezing, or decreased breath sounds. The following tests may also help with diagnosis: AAT blood test, arterial blood gases, and chest x-ray, as well as a CT scan of the chest, genetic testing, and lung function tests. Your healthcare provider may suspect you of having this condition if you develop COPD before age 45, COPD but you have never smoked or been exposed to toxins, COPD and you have a family history of the condition, cirrhosis and no other cause can be found, cirrhosis and you have a family history of liver disease. So notice that one of those options here says COPD but you have never been smoked or been exposed to toxins or even secondhand smoking, because COPD is a condition that is most common in smokers, but if you have that without having been a smoker previously, this is a big indicator that you have AAT deficiency. Here's the outlook, the prognosis. Some people with this deficiency will not develop liver or lung disease. If you quit smoking, you can slow the progression of the lung disease. COPD and cirrhosis can be life-threatening. Possible complications. Complications of AAT deficiency include bronchiectasis, which is damage of the large airways, COPD, or liver failure or cancer. Alpha-1 Antitrypsin Deficiency, AAT, is a genetic condition that can lead to lung and liver problems. While there is no specific cure, several treatments can help manage symptoms and complications. Here are some commonly used medications and therapies. Number 1 is Alpha-1 proteinase inhibitor, AIP1, or A1PI therapy. Prolastin C is one of those medications that falls under this Alpha-1 proteinase inhibitor drug class. Prolastin C is a purified human A1PI used to raise A1PI levels in the blood. Aralast NP, another medication, under this drug class, it's a replacement therapy. Zimera, another medication in this class, is a human-derived A1PI used for similar purposes. The second drug class is bronchodilators, which are obviously normally used for asthma, and those are for the lung symptoms. There is albuterol, which is a short-acting bronchodilator, and salmeterol, a long-acting bronchodilator. There's also corticosteroids, drug class, in case of exacerbations. And we have prednisone under this drug class, which is used to reduce inflammation in the lungs. And then number 4, we have antibiotics for respiratory infections. So we can use azithromycin, which is often used for chronic bronchitis or infections. Supportive treatments such as oxygen therapy for patients with low oxygen levels, because remember, this affects their lungs and their liver, so they're having a hard time to breathe, so the oxygen is obviously for the lungs component. Pulmonary rehabilitation is another option. It's a program that helps improve lung function. It's important for individuals with AAT deficiency to work closely with healthcare providers to tailor treatment to their specific needs. Now you need to watch my video on alcohol withdrawal or have a look at benzodiazepine withdrawal.